Hi, I'm Keith Lonergan. I'm one of the orthopedic surgeons with Steadman Hawkins Clinic of the Carolinas, affiliated with GHS. Today I'd like to talk to you about anterior cruciate ligament injuries of the knee, or ACL injuries. Oftentimes, we see patients in the office that have knee pain. It also can be in conjunction with knee instability or giving way of the knee. These may be indicators that the ACL is torn. The ACL is a ligament that provides stability to the knee. Oftentimes it can be torn in an athletic event or a traumatic injury, such as slipping in the bathroom, or in more high velocity injuries, such as a motorcycle accident or a car accident. More often than not, the ACL is torn in an athletic event. It's torn as the knee twists, and the patient oftentimes feels a pop followed by an inability to continue that recreational activity. The knee will often swell rapidly within a couple of hours, and the knee will feel stiff and tight. When you present to the office with a knee injury such as an ACL, we will go through an extensive history-taking process to try to determine exactly how the knee was injured, followed by a very thorough knee exam where we can test the knee stability as well as for any associated injuries that may have occurred, such as a cartilage tear within the knee, and then determine whether or not this is an ACL injury that would require surgical intervention. Certainly, most knee injuries that have an ACL that is completely torn in a young, active individual would be an indication to perform what we call an ACL reconstruction. Unfortunately, the native ACL, once it's torn, it does not have the ability to repair itself, and the knee will become unstable, certainly with advanced running, twisting, pivoting maneuvers. When the knee becomes unstable, it oftentimes can lead to further injury to the cartilage surfaces of the knee. In particular, the end of the bone cartilage, called the articular cartilage, as well as the meniscal cartilage, which are the shock-absorbing cartilages of the knee. If we determine on physical exam that the ACL may indeed be torn, we may ask that we provide a service such as an MRI. An MRI is a radiological imaging exam that gains further information about the ligaments and cartilage in the knee. A radiograph or an X-ray would also be taken primarily to determine the bony structures of the knee and make sure there is no fracture or broken bone associated with your knee injury. If you indeed have an ACL injury and you are experiencing knee instability, we would discuss the ACL reconstructive process. As I've mentioned, the torn ACL has no ability to heal. And surgical techniques such as trying to actually sew the torn ACL together have been fraught with problems in the distant past. Over the last several decades, we've learned that an ACL reconstruction is required. The reconstruction is done by taking new tissue, either from your knee or from a donor, to provide a new ACL ligament. This is what we call a graft. The new ACL graft or new tendon can be placed into the knee where the old ligament was in order to provide stability to the knee and to protect the cartilage. Primarily, the tendons that are used for ACL reconstruction can be found around the knee in the area where we are making the incisions to put the new ACL. One in particular is called the hamstring graft. We take 2 hamstring tendons from the knee and make them into a new ACL. We also can use a donor tendon, or so-called cadaver tendon, to provide the new ligament. The surgery is generally done in an outpatient basis or just as an overnight stay. The vast majority of this technique for ACL reconstruction is done arthroscopically, or through small incisions around the knee, utilizing a camera and small instrument called a scope. And I'll show you the scope and the camera that we would use. We can place this in the knee joint as well as work through other small incisions called portals to remove the damaged ACL and provide access and visualization for placement of the new ligament. When we place the new ligament in the knee, we have to make small bone tunnels to provide the placement of the new ligament. Once we drill these tunnels into the bone and place the ligament across the knee joint, we can secure it to each side of the knee joint. It goes up through the center of the knee and into the thigh bone to secure it both to the thigh bone and to the shin bone below. After the ligament is secure, it provides stability to the knee so the knee cannot twist or buckle after the rehab process and healing of the new graft has occurred. After your ACL reconstruction, you will most likely be placed into a physical therapy regimen the next day. The hallmark of the physical therapy regimen initially is to maintain full extension of the knee, which is the straightening of the knee, as well as begin the work of rehabbing the muscles and decreasing the swelling around the knee. You may be on crutches for a couple of weeks and sometimes up to 6 weeks based on any other injury that you may have had with the cartilage that needed to be addressed at the time of surgery. Oftentimes you will be in a brace initially and transition out of a brace as you become stronger and with better motion. It's imperative that a good rehab process be developed and maintained in order to have the optimal result from your ACL surgery. If you feel as though you're having knee pain with instability, giving way of the knee, and or what we call mechanical symptoms such as popping and locking within the knee joint, you may have an ACL tear. If you have any of these symptoms, please don't hesitate to call us and we'd be happy to evaluate you. Thank you for your attention.